Friday morning staple for the past year plus is a visit with some of the folks from the county of Imperial as we update the COVID-19 situation and also find out what else is going on. With us this morning, we have Imperial County Public Health Department Director Janette Angulo and the County EMS Manager, Chris Herring. And first off, Chris, I am standing at attention and I salute the EMS workers in Imperial County on this EMS week.
Good morning, Carroll.
Good morning.
Good morning, Carroll. How are you?
I am well. Okay. First off, let's start with Janette and find out a little bit more about what's going on. COVID-19 vaccinations are available, and they're even available on a walk-in basis at the Imperial Veterans Hall in Imperial, right?
That is correct. Yes, there's quite a bit going on with vaccination. If you go to the My Turn site, you'll see many different locations, including, clinics at the hospitals, at the Veterans Clinic, at pharmacies, at medical provider offices. We've been partnering up with the Office of Education, so we have some clinics coming up at the Alternative Education site over on Ross. We also have a clinic coming up at the Imperial Valley Center for Exceptional Children. So quite a bit going on, a lot of access points. If you go to vaccines.gov, you'll see that there's over 33 providers listed on that federal site. So a lot of access to the vaccine in Imperial County, Carroll.
Okay, and as I did point out, even available on a walk-in basis. Yes.
For Public Health Department clinics, they are available on a walk-in basis, and that is at the Social Services Department site, as well as other sites that where we're holding clinics. It's the same with many of our providers, so I encourage the community to call and ask if they're accepting on a walk-in basis.
Okay, and you can check on My Turn. Is the My Turn phone number still valid?
Yes, it is. 1-833-422-4255. And so if anyone is in need of transportation, when they make that call, just let the individual know on the other side of the line that you need transportation. Or if someone needs a person to go to their home to give them the vaccine because, they have limited mobility or they have a certain medical condition, then the state will arrange for that. They'll make the call back to the health department, and the health department will go to the individual's home. So, yes, that number is still active, and the myturn.ca.gov for pre-registration is also available.
Okay, and eligibility for the vaccine?
12 and older. And for the 12 to 17-year-olds, it's the Pfizer vaccine. And if you notice on the My Turn site, there's quite a bit of Pfizer vaccine available throughout Imperial County. So we're hosting clinics for individuals 12 and older, and that started on the 13th of May.
Okay, and still waiting for guidance from the FDA, CDC, as I know they are undergoing clinical trials for younger kids as well.
Yes, that's what we're waiting for. Hopefully by the fall, we're crossing our fingers, if not early 2022.
Okay. And one of the issues, and I know it has people confused, is the mask mandate. Guidelines were issued, and again, they are guidelines from CDC, but California has kept the mask mandates in place, right?
Yes. So the state of California, looked at the CDC recommendations, and after careful review, they decided that they were going to keep their state guidelines as is, and the same with Cal OSHA. They met yesterday, and they have the standards, Cal OSHA standards, which they were going to present revisions to better align with the state guidelines. So both of those will not go up for review again or any modifications until June 15th. And that's when we hit the beyond the blueprint date. So at this point in time, masking guidance in California stays as is. Okay, and I'm assuming by the 15th we get rid of the Skittles scale as well. Yes, although let me tell you, so the metric system, I'm pretty sure it's going to go away. So the case rates and movement from tier to tier for sure. Okay. However, epidemiology departments across the state, we're still going to keep an eye on the case rate, the positivity percent, and all else, because we need to continue that surveillance activity in our community. And that is all part of science. Yes, it is, and part of our public health department's work. Okay. And where do we stand? Are people getting the vaccine? They are. They actually are. Although a little slower than in past weeks. Let me tell you, this last week, and this is collective between all vaccine providers, we gave almost 5,500 doses in Imperial County. That's between first and second doses. So the demand is a lot lower, but slowly but surely we keep on vaccinating. Okay, and those efforts will continue. Yes, they will. Yes, they will. And again, I encourage individuals to get a vaccination as soon as they can. Okay. And we'll keep you informed as to where the vaccines and that information available on AM 1230, FM 107.5. We also utilize our Facebook page, our website, and our YouTube channel to get the information out. So there you go. Okay, Chris, good morning.
Good morning, Carroll. How are you?
I am well. And as I said, at attention, I salute EMS workers. It's the National EMS Week. So how are we celebrating?
So we're celebrating this year kind of a little bit differently than we normally would. We still can't quite get everybody together for some of the barbecues and picnics and stuff that we've hosted in the past. I know the provider agencies are generally feeding their crews on their shifts. We did some recognition earlier this week with our Board of Supervisors. And other than that, it's just asking the community to tell them thank you. Okay. Now, let's clarify. Who are the EMS workers? So traditionally, you might just think, EMTs, paramedics, firefighters, but our EMS system is actually a pretty large and diverse group of specialty fields that really bring everything together. From the dispatcher that takes the 911 call and sends the resources, to the specialty care centers, not necessarily only in Imperial County, but our trauma centers and cardiac centers that are out of the county, and our stroke centers, and everybody in between, including just the general public, anybody who's walking around who may start first aid treatment, may start CPR. We consider them all part of our EMS system. Okay, and they have been quite active this week with several major fires. They have. I know our fire crews have been out and about. I think they've had a major fire every day for the last 3 or 4 days, including this morning. And really looking at the past year, and I had to go back and look at my calendar, but this is the second Friday during EMS week I've got to spend some time with you on the radio to kind of express the thanks to our field crews. Last year, I think we were sitting in a very different position than we are this year. We were a few days from opening our alternate care site out at IVC. We had already started the work on it. It accepted its first patient a few days after we spoke during EMS week. So our system has endured a lot over the last year. Our providers have stepped into stepped and faced all of the challenges they've seen over the last year head on without hesitation. They've experienced some illness, they've experienced some loss amongst, whether it's family, friends. This pandemic has touched all of us. But our EMS providers kind of stepped into it and just kept charging forward.
And you brought up a good point. What is the status of the alternate care site, the all those auxiliary tents that have been set up at the local hospitals? Where do we stand on that?
So our alternate care site, we still have a small group of state personnel. They do have equipment and supplies at the ready. It's moved from the college over to our fairgrounds. It's not open, but we have the equipment and supplies and a small group of people to be able to reopen it quickly if we need to. Knock on wood and pray we don't have to get there. Our hospitals seem to be very stable at the moment. As of yesterday morning, we had 13 COVID patients in both of our hospitals. Only 3 of them were in an intensive care unit. So much different than this time last year.
Oh, yes. And after a year, we seem to have a reasonably good handle on treatments, therapies, and how to cope with this.
Yeah, the treatments and therapeutics have come a long way, and I think that's part of what's helping us keep our hospitals in good positions. They're able to treat more mild cases of illness and prevent them from becoming those severe cases that we had previously seen. And then the vaccine seems to be working wonders at this point in our community as well.
Okay. And is El Centro Regional and Pioneer still doing the infusion therapies?
They both still have access to the infusion therapies. They both utilize them whenever it's called for.
Okay. So progress, has it been a year? It's more like 14 months, 15 months, I think, that we've been doing this. But
just about 15 months for our public health staff, and I'd say 14 months for the rest of us.
Okay. And are you still operating out of the Emergency Operations Center?
So I get to spend time in my office now.
Really?
Our Emergency Operations Center is still active in a virtual sense. I think that's one of the other, if there's any benefit to the last year, there's some good process changes and other infrastructure that I think we've all been able to develop. Our EOC can really at this point operate virtually for anything that it needs to do. So I think that's if there's anything positive to look out from the last year, that's one of them. Trying to stay positive, I think just getting back to our EMS providers and talking about EMS week, our system proved that it could work. We did require assistance from outside Imperial County, but all of that was built into our plans before. We've talked about our mutual aid system in California and the country in the past as well, and I think the last year really highlights how well that system is able to work under extremely challenging conditions. Just as a note, we had ambulance strike teams coming into Imperial County. We had air ambulances from other counties and jurisdictions. We had somewhere probably north of 1,000 medical providers come into Imperial County through our mutual aid system, whether they were working in our alternate care sites or working at our 2 hospitals. We've had National Guard deployments, from everything from staffing medical facilities, delivering food to seniors. We've had, National Guard vaccination team on the ground in Imperial County for I think close to 3 months at this point. So a lot has come in over the last year, but a couple other highlights. We pushed out a video earlier this week, kind of highlighting what EMS has done over the last year. There's some pictures in there that you might recognize not being in Imperial County. So even as much as our system was stressed, we were able to provide assistance to other communities, mostly through our fire department strike team deployments, but we actually also deployed EMTs and paramedics to other California counties for vaccination efforts as well.
Okay. And that is all part of the mutual aid system that has been in place in California for quite a while. I know the fire department with strike teams that are activated throughout the brush and forest fire seasons.
Yep.
Okay. Well, we certainly appreciate the visit and the updated information. Okay, we've got some things coming up, Janette. Graduations. We've got, and it appears that most of them are going to be live events. And also Memorial Day weekend. Any words for the upcoming events?
Yes, so graduations, we've been working closely with schools, whether it's the higher education, the high schools. So there's guidelines out there, and we make ourselves available to assist in any way we can and provide those recommendations. And so mask wearing is really important. I actually attended my daughter's San Diego State graduation earlier in the week, and it was very nicely done. So
another Aztec. Let's hear it for us Aztecs, okay?
Yes, a drive-through, and they got to experience the experience. So they're doing a very nice job when it comes to graduations and ceremonies. As far as Memorial Day weekend, just a reminder that the pandemic is still here. We're still seeing cases. Earlier in the week, unfortunately, we had to report, a pediatric death. And that's where I can't say it enough. That's where vaccination is key. It's a great tool to help protect those that can't actually get a vaccine right now. So if you haven't had a vaccine, you're still thinking about it. Again, the pandemic is still here. The virus hasn't gone anywhere. It is a lot, more stable. But again, vaccination is key to all of this. So stay safe, keep wearing a mask, distance, and stay home if you're sick.
Okay. Chris, Janette, we appreciate the visit this morning and the updated information. And as you said, stay safe. The virus is still with us. So, just keep staying safe.
All right. Thank you for having us, Carroll. Take care.
Thank you, Carroll.
Okay. You guys have a great weekend. And as I heard, stay safe.
Thanks. You too, Carroll.
The best oldies on the radio.
Imperial County Air Pollution Control District provides you with air quality reports daily. How is your air quality today? Check current air quality conditions in Imperial County at imperialvalleyair.org. You can sign up for free air quality alerts to be delivered directly to your email address, or you can download the Air Quality Alert app to your mobile device today. Stay informed with Imperial County Air Pollution Control District.